Now, when we think about high blood pressure, we tend to think that it affects older people.
However, high blood pressure can affect people in their 30s and 40s, and new research suggests that this may be damaging their brain in the long term. To tell us more about this, we're joined now by Professor Robert Graham, who's an Executive Director of the Victor Chang Cardiac Research Institute. Thanks very much for coming in this morning, Professor.
Pleasure.
Let's start off with the very basics. What is high blood pressure?
High blood pressure is where you've got excessive constriction of the small blood vessels, and that causes the heart to have to push blood through those constricted vessels with more force, and so the pressure, you need more pressure to get the blood through. And if that goes above certain levels, that can cause problems, and particularly it's a huge risk factor for stroke, and stroke doubles your incidence of dementia. So we can treat high blood pressure, we can prevent strokes, and we can prevent dementia. In fact, 90% of strokes have been calculated to be preventable, and 35% of dementia have been calculated to be preventable.
So what's interesting with this new research is that the critical period for people is between their 30s and 40s. If they have high blood pressure, it can affect them 40 years later.
Yes, I don't think it's the critical period. Has now been realised that it's probably earlier than we thought. We thought that high blood pressure generally comes on in your 40s and 50s, and even later than that. But now this new research is suggesting that we need to even look at people in their 30s. And I think it's common sense that sometime in your 30s you should have a general checkup, and hopefully GPs will check blood pressure and see whether it's high or not.
This is a bit of a wake-up call, I think, especially for younger people who might not consider this to be a factor that they should be worried about. How, apart from going to the doctor and having that pressurised cuff put around you, how can you keep a check on your blood pressure?
There is no easy way, and unfortunately high blood pressure is called a silent killer because you don't know you've got it. So the only way is to have your blood pressure checked. I mean, some people do get headaches, they can get other symptoms, but generally it's a silent problem, and so you do need to have it checked. The concern is that even if we screen for risk factors such as high blood pressure, and at the Victor Chang Cardiac Research Institute, we've now screened 68,000 people for cardiac risk factors. And we've only done preliminary surveys, but it looks like fewer than 30% of those people, even though we tell them that they've got high blood pressure, go to their doctor and then have it treated. So that's a real worry, that people are interested enough to be screened, but then they don't do anything about it.
And what's interesting is that it's often thought that it's mainly diet, lack of exercise and things like that, but people can look relatively healthy and still have high blood pressure.
Yeah, it's there's quite a strong genetic component, so you've got to choose your parents carefully.
Yeah, but also it is partly lifestyle factors, but also stress levels can really impact this as well.
They can. Stress levels, it's hard sometimes for people to reduce those, but exercise is very good, meditation, and just trying to avoid things that cause stress in your life is important. But equally important is keeping your weight down, stopping smoking, being careful with how much salt you take in your diet is very important, because it's been shown there's a very strong association between salt intake and high blood pressure.
You can also take medication. What's the medication that's available, and what are the side effects that come with it?
There are many, many different types of medications, from beta blockers to angiotensin-converting enzyme inhibitors, diuretics, and the list goes on. Generally, if we start early, when the pressure is not too high and we don't have to use big doses, the side effects are that you don't even know you're taking the drugs. Yeah? And that's true most of the time. Some people will get certain side effects to particular drugs, but then we can change them to a different one. So they're very tolerated drugs, and many people live with these drugs for their whole life. And it is probably the most exciting effect in medicine we've ever seen. If you don't treat very high blood pressure, what we call malignant high blood pressure, you're dead in 6 months. If we treat it, you live a normal life. There is no other treatment in the whole of medicine that will change you from living 6 months to living a whole life. Not even a ruptured appendix. Yeah.
So what is the reasoning, do you think, that people tend to try and ignore high blood pressure? Do they just want to put their head in the sand and just not think about it?
Well, look, nobody likes to take tablets every day, and some of us ignore the fact that we may have problems and you don't want to know about it. But I think we're becoming much more conscious of it. And fortunately, in the high-income countries, actually the incidence of stroke and dementia is falling. from 1986 to now, but in the low and middle income countries is actually rising. That suggests there are modifiable factors, and the most likely ones are that people have to be screened early and be treated properly, which we're doing to a better extent, but still far from perfect in the high income countries.
Professor, we really appreciate you coming in to speak to us. Thank you.